What is tube feeding? Everyone has unique nutritional needs, and in cases of complex health issues, a patient may not be able to ingest food through conventional means. In such instances, supplementary feeding may be necessary based on the patient's medical condition, which may be either temporary or permanent. The type of feeding and method of administration depends on individual needs. Factors such as weight, height, activity level, medical condition, and home circumstances will impact this decision. Additionally, the ability to eat and drink some amount on their own is considered. When in the hospital or community care, a dietitian will discuss the most suitable feeding options to ensure optimal nutrition and care. NICE guidelines outline various types of tube feeding based on the patient's needs. These tubes are generally categorized by their expected duration of use and the route of administration. The choice of feeding tube route depends on how long the feeding is expected to last. Royal Marsden guidelines emphasize the careful insertion of nasogastric tubes, which should be confirmed through a chest or abdominal X-ray before feeding begins. They highlight the importance of measuring and documenting the tube length, checking it before each feeding, and not relying solely on the air Hush test. Aspiration risk must be avoided. 1. Types of tube feeding. Nasal tubes, short-term use. Inserted through the nose. Nasogastric tube, nasoduodenal tube, nasojejunal tube. This is used when feeding into the stomach is not tolerated, for example, vomiting or aspiration risk. Surgically placed tubes, long-term use. Gastrostomy or G-tube, jejunostomy or J-tube, gastrojejunostomy or GJ-tube. Questions. What is the difference between a PEG tube and a J-tube? Why might a patient require both a PEG and a J-tube in one device? How can you determine which tube should be used for administering feeds or medications? Why should the J-tube not be manipulated, pushed, or rotated in the same manner as a PEG tube? Caution. Always practice within your scope of competence. If in doubt about the feeding plan or the administration of any feed or medication, seek guidance from a clinical professional before proceeding.